Well, hello again, beautiful. Do you suffer from scars, either from acne or surgery or chickenpox scars, and you've tried everything you could to get rid of them, but they are still there? If that's you, you have to watch this video because I'm going to show you one of the best ways to treat your scars to make them softer and nicer. Today we're doing a microneedling procedure on our beautiful patient here, Rachel. Hello. Now she is basically flawless, don't let her tell you anything else, but she does have a few acne scars and a few pigmentary changes that she would like to improve on. Microneedling is one of the best ways to deal with your scars. It is comparable to lasers, but it's less expensive, less downtime, and the results are very similar. And how does it work? We are building new collagen. But what is collagen? It's really the ground substance that holds your skin up and it makes you feel and look youthful and rested. You can use a home microneedling device and you can have it done professionally. But the basic idea is the same. The unit is rolled on your skin and multiple needles penetrate the skin. With minimal injury to the surface of the skin, however, the magic happens in the dermis, which is the layer right under your surface of the skin. And what happens here is we cause these small micro injuries, which then lead to a healing cascade where multiple healing factors come, such as platelet-derived growth factors and collagen-stimulating cytokines to build new collagen. So as you may be able to see, she has a couple of acne scars here, some erythema from a few resolving lesions of acne, and a couple of areas of discoloration, which will all be improved with the microneedling procedure. First, you clean your face and you apply a topical medicine for about half an hour to really ensure your comfort. This is a very well tolerated procedure with minimal pain. Your face is wiped off and disinfected and you're ready to go. Microneedling can be done with PRP. While your numbing medicine is working, your blood is being drawn and it's being spun out. We separate the cells from the clear portion of your blood, and that's what's called PRP, platelet-rich plasma. And just like in an ultrasound, you need to have some kind of gel on your skin. For microneedling, you either use hyaluronic acid, or in PRP, you use the PRP solution, which is applied all over the skin surface, and then the machine goes and runs on that. So we're going to use one of the best machines available. And the reason I chose this machine is that it's the only device that is dual FDA cleared, not only for acne scars, but for wrinkles as well. So this is the machine. One of the reasons that I love it is because one is a desktop machine where you can see your numbers clearly, your buttons are easy to reach, and most importantly, your device is connected to power, so you will never run out of power. Every penetration of the needle is consistent and of equal strength and efficacy. The pedal is on and off. You turn it on, you turn it off, and you don't have to worry about it. Then of course we have our magical juice, which is the PRP. How is the discomfort, Rachel?
It feels like if you're taking a nail file and dragging it across my skin, but it's not painful, I would say. It's just...
We are at the conclusion of the procedure, and as you can see, the patient is definitely red. We are looking for that blush and very slight pinpoint bleeding, and I think we achieved that amazing result. Also at the end, whatever PRP you have left is being applied to the skin, again to push that magical substance deep into your skin. And it is magical because these little cells, the platelets in your bloodstream, are containing a lot of the factors that build growth of multiple structures in your skin. For the next couple of days, it's very important to avoid anything harsh on your skin. So use only gentle cleansers, sunscreen and sun protection using mineral sunscreens, and really avoid makeup for the next 3 to 7 days. And why is that? We are having these small wounds in the skin that we are trying to heal, and we're trying to avoid any kind of infection or chemicals from making it worse. So be gentle with your skin, avoid chemicals, impurities, and even exercise with excessive sweating. In addition to scars, you can use microneedling for hyperpigmentation or any other discoloration problems, such as melasma, periorbital hyperpigmentation, rosacea, red spots, or really any other color changes on your face. It can also help with hair loss, and specifically with alopecia areata, which are those round patches of baldness, and androgenetic alopecia, which is the male pattern baldness, where there's a diffuse thinning and a receding of the hairline. In addition to that, of course, microneedling helps with the rejuvenation of the skin, taking care of your fine lines and wrinkles. It is also used for excessive axillary hyperhidrosis, which is the excessive sweating, as you could have guessed. And as you can imagine, your healthy, intact skin creates a nice barrier between you and the environment. But when we as doctors want to actually give you medications that go into your skin, microneedling is what causes those little holes, the channels through which we can now push those medications in. And what are they? Hyaluronic acid, medications such as triluma, tranexamic acid, which are for hyperpigmentation, and even things like Botox that is used for rosacea and other chemicals like that. If you have uncontrolled acne with tender and red zits and cysts, you should not have this procedure done. Additionally, if you have any kind of infection on your skin, on your face, on your lips, such as a cold sore or a bacterial infection, please avoid this procedure. It is also contraindicated if you recently had a tan or significant sun exposure. And why is that? Being exposed to the ultraviolet radiation is an insult to your skin. So your skin is already trying to heal and compensate for that injury. We should not add another insulting procedure to your skin. So you need to allow your skin to rest and to heal before you have your microneedling. It's also contraindicated if you have any kind of hard to treat chronic skin condition such as eczema or psoriasis. Patients that are likely to form keloids from any kind of surgical or traumatic injury should avoid this procedure. Patients that are immunosuppressed should avoid this procedure as well because they may not be able to defend themselves against any infections. And last but not least, do not stack it with other procedures such as Botox or other neuromodulators. And that's because when we apply Botox to one area, we really want the toxin to stay in that area and not migrate down. And when we do microneedling, we roll the device over your face, we move the skin, we bring a lot of fluids and blood flow, and the toxin can migrate, and we never want that to happen. As you're planning your procedure, please keep these things in mind. 1, you should consider having it done professionally, where we use a sterile needle head for every procedure. And when you think about it, you're injecting multiple needles into your skin, and you want those needles to be clean and sterile with every procedure. When you are at home, you're rolling them on your skin, there's blood left on the needles. And I know you clean them and you try to disinfect them, but as we know, they are not sterile. Number 2, it is important what you apply to the skin after the procedure. And in this case, less is more. We only recommend hyaluronic acid or PRP to be applied after the procedure, and really to avoid things like vitamin A and vitamin C. We actually have very good studies that show that applying vitamin C after the procedure can lead to a terrible lifelong side effect. And that is foreign body granulomas. When the body sees a foreign substance that it cannot process, it doesn't know what to do with it. So it forms a wall around it and you have a granuloma. And this unfortunately can last forever. So I would recommend against applying vitamin C and a lot of other substances after your procedure. The results of microneedling are cumulative. And that means if 1 is good, 2 is better, and 3 is even better. Because what you built a month ago now gets better the second time and even better the third time. So there's no end point. You can have one done every month, really forever, and you will continue to see improvement. All that being said, remember, this is a relatively new procedure. We only started doing it about 20 years ago, so we don't have the data to show us what happens in 30, 40, 50 years later. We don't have the randomized, placebo-controlled, double-blinded studies to show us if it's truly better than lasers or other procedures. So we go by expert recommendations. However, microneedling is one of the most cost-effective procedure with the least amount of downtime and the most amount of results. That when you compare it to lasers or any other procedures. In my area, a bundle of 3 treatments runs for about $1,200. And again, this will depend on where you live. So if you're experiencing scars that are really hard to treat, from acne, from chickenpox, any other conditions like hyperpigmentation or the things that we mentioned before, please know that microneedling is a tool that will really help you. It's easy to do, it's affordable, with amazing results, and it will definitely help you with your problem. Thank you so much for watching, and please subscribe if you enjoyed this video. Follow me on Instagram, and I will see you in my next video.
Bye.
Bye! Please subscribe if you enjoyed your video. What am I saying? I know. Perhaps subscribe. So bear with me, I'm sorry. Okay, we're gonna go down for that.